Good morning, viewers. Early Christmas wish for everybody and a Happy New Year in advance. So at this end of the year, I would like to have a small chat with you all on a very important topic that is really very interesting and knowledgeable to know. What I would like to discuss with you is how do we deal with high-risk pregnancies, which is trending very much in modern days and modern women. Now, whom do we call a high-risk pregnancy? A high-risk pregnancy may be defined as something that is causing an outcome not so much wanted, or an outcome which may be harmful both for the mother and the baby. And now this high-risk pregnancy can be a condition which may be because of the present pregnancy or few of the previous conditions. Very fast, I would like to highlight very common causes. The first, I would say, which is a very common one, is the age at which you are becoming a mother. An age before 17 or a mother after 30 bit itself poses a high risk to the pregnancy. Apart from that, there may be some other medical conditions existing like pressure, sugar, thyroid, all untreated, not well managed, any other medical condition of the lung, heart, kidney, or maybe some psychological problem or depressions, or another very important thing, some addictions. Nowadays, as we are moving fast to a faster society, we are picking up good habits and we are picking up bad habits too. So smoking, alcohol, some addictions may also be very harmful and pose as a high risk for the pregnancy. So I think I've covered the reasons. Now I would like to highlight how do we avoid it. First, let us consider the factors which are existing with us, that is the age. So let us cross that age bar. Let us try to conceive before 35. Now I would like to add, that doesn't mean that you cannot be pregnant and all pregnancies will be troublesome. But my point is that keep a note on these high risk factors. Next, a very important thing, be it a normal pregnancy in the normal span or the factors which we are calling high risk, need some things to be done, like have a healthy diet, start folic acid, keep on exercise, walking, avoid addictions, and try to keep as calm and relieve your stress. Stress at the time of conception or during conception or at the time of pregnancy has seen to put an adverse effect on the outcome. Next is go for a regular checkup, consult your doctor before pregnancy, start prenatal checkup, get your thalassemia tested, have the vaccinations that you were due for, and know the time that you should go for it. Treat your urinary infections if any, treat vaginal discharge if any, know your thalassemia, know your hemoglobin, check a blood sugar level, check your thyroid. Even in your partner may have some medical problems too. So let's treat those. Okay, so this is one of the important factors that we are counteracting the high risk pregnancies. Next, how do we deal it? Some factors are related to the pregnancy, like suppose you develop pressure or you had pressure from before. So this will have an effect on your pregnancy. The pressure may shoot up, may affect your baby, like having preterm delivery, low birth weight, some complications exclusive to hypertension like eclampsia or preeclampsia. That is some severe consequences related to the hypertension. Now all these are detectable, manageable, treatable, and these will lead to good outcomes of pregnancy, provided you take note to the high-risk pregnancy, provided you take care to the high-risk pregnancy. Then let's come to another condition. Say there is a preterm factor which is a high risk, even if you had it before. Sometimes there are structural problems of the uterus. You may have a fibroid, you may have some congenital abnormalities of the uterus, like you may have two cavities for the uterus, you may have a septa. Another very common thing that we find is that cervix, that is the mouth of the uterus which holds the pregnancy tight, becomes loosened, either by congenitally or maybe repeated abortions or any other pathology. So if we know they are there, if we know it persists, if we know that this factor may pose a problem, then we deal with it. If there is a tumor, get operated if needed. If there is a cervical problem, we should go for a second trimester scan to know what is the length, whether you need any further medicine, whether you need rest, your infection need to be treated, and at times even we put a stitch at the level of the cervix, which we call the McDonald's, which helps to prevent the cervical incompetence. Then you may have diabetes. That may be present from before, you may acquire it during the pregnancy. So your diet need to be proper. You need to talk to a dietitian, you need to talk to the obstetrician, you need to have proper food, medication. We do take help of the physician endocrinologist also to handle this high risk pregnancy of diabetes. Now, there may be other factors like stress. The emotional component needs to be highlighted in today's perspective. You may have some depression, you may develop depression, because the state of mind of the mother do predicts the outcome of the baby. They are related to small babies, early deliveries, and if you don't deal this part of the problem before pregnancy or during pregnancy, after delivery, that becomes a big issue. And the next important thing to handle with blood hemoglobinless, that is anemia. You may be anemic, you may be thalassaemic, then you should know your partner's thalassemia identity also. If at all you are diagnosed with it, be treated accordingly. When you become pregnant and your partner and you both are carriers, we go for pure antenatal test. That is, we go for test that we take out the tissue from the baby in the womb, detect whether the baby is affected. If not, we carry on with the pregnancy. So these all come under high risk pregnancies which need to be managed, detected and followed up with. Then there are other issues like which you develop as high risk. There will be multiple pregnancies. You may have twin, you may have triplets. And in today's perspective, when we are moving to artificial techniques of reproduction, IVFs, then we have found that the incidences of having multiple pregnancies have gone up. It itself is a high risk factor, and we have noted that in these multiple pregnancies, the associated medical problems like sugar, pressure, placental localization, having early deliveries, preterms, cramps, they are more frequent. So apart from it itself being a risk factors, all these medical problems add up to the high risk factor. Then there is the medical term. Suppose you have a cardiac issue, it needs to be sorted out. Suppose you have some kidney problem, you should know the do's and don'ts. Many a times it has been seen the medical associated problems in pregnancy, which may persist from before or which may develop, needs early delivery. So we need to contact a proper pediatrician. We may have to consult a perinatologist. Who are perinatologists? They are doctors who are specially working on high risk pregnancies. And then comes once you are pregnant, how do we monitor? We definitely monitor by the blood test that we do, and another very important tool to monitor this high risk pregnancy is the ultrasonography. As such, we definitely go for 2 scans, one early, one mid-pregnancy scan. And another important tool, that is the UHG, may be required more frequently in high risk pregnancies, and that at times add up to weekly scans and other tests that we call the biophysical profile. Now, what is biophysical profile? It is a test where we do a monitoring of the baby's heartbeat related to the movement of the baby inside the mother's womb. We apply the device on the mother's tummy and we monitor the baby's heartbeat related to the movement. This is the first test, and then we move on to the ultrasonography. So this is a non-stress test where we monitor the baby's heartbeat related changes with the movement, and with the sonography we monitor the fetal respiration, movement, its amniotic fluid. We have such 4 factors and each have been scored with 2. So we add up the biophysical profile, and if we get it between 8 to 10, we say it's fine, the high risk pregnancy is going fine. Suppose it's less than 8, then we move on to repeated test. We do repeatedly, and times we find that the baby is not growing well, or the water is, that is the liquor, is drying up. Hence we call it oligohydramnios. Such babies need weekly, at times bi-weekly ultrasonography, CTGs and Dopplers, and we decide upon when to deliver, when not to. Can we pull through the pregnancy? Should we add up some supplement? Should we go for frequent monitoring? Many a times we send you to a pediatrician to have a workup from before, and at times we find that we do deliver them much earlier in a better setup, so that the baby that comes up lives in a better environment rather than inside the womb. So to sum up, I would say that first we have to know, we have to be aware about the high risk factors. That doesn't exclude that normal pregnancy should not be looked upon. It is added test, added precautions, added habits to the existing one. Stress on diet, exercise, avoidance on stress, contacting doctor, correcting your problems, looking into the medical problems. Then once you conceive, add on to the supplements. Have your folic acid, have your iron, calcium, schedule vaccinations, tests that needs to be done during the pregnancy, like the sugar, thyroid. Even nowadays we look into the liver problem, because now we find intrahepatic cholestasis, that is a condition related only with the pregnant ladies. That is, because of the pregnancy, the baby's liver salts get deposited in the mother's liver. That causes a rise of the the liver enzymes of the mother. But it has an adverse effect on the baby itself. This itself is another high risk factor. So we detect it, we treat it, we follow with blood tests, with sonography consultations, then we plan out the treatment. We may require steroid, we need a better setup, we may deliver early, and the whole thing does not end just with the delivery. It has been noted that we can definitely opt for vaginal, we can definitely for caesarean section. But the group that we are encompassing in high-risk pregnancies actually needs more C-section than normal ones. Even the C-sections at times need better monitoring, shifting to the ICU. At times we need blood at hand. When the patient develops blood sugar, then at times we need to shift in the ICU, monitor BP, give intravenous antihypertensive to calm down the blood pressure. Apart from that, other high-risk pregnancies that need to be mentioned are the placental problems. Many a times we have placental previa, that is, the placenta present in a much lower position than it should be. Normally what happens, the baby comes out either vaginally or through cesarean, and we remove the placenta once it gets separated by itself. So this is the normal thing, and the uterus comes down to the previous shape. In placenta previa, the placenta is in a lower position. So getting separated from the uterus, or if the labor pain starts, there is tremendous bleeding up to the degree that it may harm the mother and the child's life. We may even lose both. So we have to diagnose, monitor, predict, deliver in a planned manner with blood at hand. Maybe you will need a better setup. You may need an ICU, you need a senior anesthetist. The pediatrician should be aware. Many a times she may bleed at 32 weeks. So the setup should be there, the preparation should be there to handle a problem like this. Blood, at times we need blood transfusion even up to 6 to 10 bottles. So considering a high-risk pregnancy is considering it as such a whole thing. So again, I would say that we prevent this, we accommodate it, we manage this by follow-ups, regular checkups, and keeping a good eye on it. Thank you.